Thank you, and thank you for having me. I'm very excited to present to all of you today. The point of this talk is actually really to talk about how important pesticides are for public health and food security. And a lot of people have ideas about pesticides from the sort of lay literature and things like that, which make people have lots of fears around them. So we're going to sort of talk about some of the important topics and discussions that are out there that are getting a lot of media coverage today. But as way of introduction, I'm an emergency medicine physician and a medical toxicologist, and lots of people say, well, how did an emergency medicine physician ever wind up in agriculture? Well, I wound up in agriculture because of this little boy. This is Fritz. He also is the reason why I'm a doctor. So way back in 1989, I was 21 years old and working backstage at a concert venue in St. Louis called Fox Theater, and living the lifestyles of the employees of the rich and famous. And my father, who's a physician, asked me if I wanted to go on a relief mission to Haiti. And I thought, wow, that'd be kind of interesting. And so we went down there and started working in an orphanage, doing volunteer work, changing babies' diapers, feeding them, things like that. And I met and fell in love with Fritz. And it was the first time that I'd ever seen full-fledged malnutrition, starvation syndromes up close and personally. And I realized I want to do something different than concert production. I think maybe I'll go to medical school. So I did that. And in order to do humanitarian aid work, I did emergency medicine as a residency, because you really sort of could do lots of different things, take care of infectious diseases, you could deliver babies, you could, fix broken bones. But during my residency, I realized I was kind of a jack of all trades, but a master of none. So I went ahead and did a Medical Toxicology Fellowship at NYU, where I learned all about adverse drug reactions, pharmacology, overdoses, and a lot about pesticides too. And then I came back to Washington University and was on the faculty there and ran the toxicology program. And in 2010, 21 years later, I was back in Haiti after the earthquake, and realized that I was kind of just putting a Band-Aid on this problem. So if you go down to do relief work as a physician, you can fix certain problems for individuals, but when you leave, you are not leaving any sort of sustainable thing there behind. So what could you do that would be more sustainable? So I started really trying to figure out what would be beneficial, and realized that if you could fix malnutrition and insect-borne illness, you would be a long way into having a society have more structural support for success. And so I started reading about golden rice, and golden rice is a genetically modified rice that makes the precursor of vitamin A, beta carotene. And it's important because vitamin A associated blindness, deficiency associated blindness is one of the leading causes of blindness in children worldwide. And it's very simple to prevent. If you drop a little vitamin A under somebody's tongue, they can prevent it. But it's very hard to deploy a big enough force out there to provide that. And so if you could have a staple crop, remember over 60% of the world lives off of 3 grasses: corn, wheat, and rice. If you could have a staple crop that would have micronutrients involved in them, you could actually prevent some of these diseases. And so golden rice was invented in order to prevent that. And then I started reading more about GMOs and thought, wow, this is really fascinating and could mitigate malnutrition worldwide and in an environmentally friendly way. Also, if you can prevent insect-borne illness with chemistries and genetic modification and other techniques, you could really help people. So that's how I got into, then in 2016, Monsanto had a job for a medical toxicologist, and that's how I wound up at Monsanto. It's all because of Fritz. Anyway, so basically, let's just start the pesticide story. And the way I'm going to start the pesticide story is give you some backgrounds on it. A lot of you may be familiar with some of these things, so I hope it's not too repetitive for you. But the other thing I'm going to do is talk about pesticides in general, and then use glyphosate, which there's a lot of controversy about, as a model for how pesticides are regulated and things like that. So for centuries, people have known that chrysanthemums had insecticidal properties. They actually secrete a chemical by the name of pyrethrum, which blocks sodium channels in the nerves of insects and paralyzes them so they die. And for centuries, people knew that they didn't know all the chemistry, but they knew that these flowers had insecticidal properties, and so they would trade them along the Silk Road. In fact, it was really important to have insecticides in military campaigns because one of the leading causes of death in the military turns out to be insect-borne illness rather than war wounds. So, for example, in 1812, when Napoleon invaded Russia, he brought 400,000 men or more into Russia, and he left with about 4,000 men, so huge losses. And the conventional wisdom has always been that Napoleon invaded Russia too late, and that he encountered the harsh Russian winters, and so many of his soldiers froze to death. Well, about 15 years ago, they were doing an excavation in Lithuania for a building site and came across a mass grave of Napoleon's soldiers. And when they exhumed and examined the bodies, they actually realized that there was a big typhus outbreak in the ranks of the soldiers, and that typhus, which is carried by lice, was probably the reason why so many of his soldiers died. So insect-borne illness is a big, huge problem for the military. Fast forward to 1939, the dawn of World War II, and there was a big shortage of pyrethroids. Now, they knew much more about this chemistry into the 20th century. So there was a big shortage of pyrethroids, which are synthetic versions of chrysanthemum dust. And there was a mad dash to try to find a chemical that would have a very low acute toxicity when you put it on people to prevent lice and things like that. And was a broad spectrum. And so a man by the name of Dr. Mueller discovered a chemical called DDT, which we have all heard lots about. But Dr. Mueller was a Swiss chemist and discovered that it had very, very low acute toxicity and was very, very effective at killing all sorts of insects, lice, ticks, fleas, and other insects that carry disease. The discovery of DDT had such a profound impact on the public health world that it actually was instrumental in eradicating malaria in the US and in Europe. It also brought down incidence of malaria in tropical areas. So, for example, in 1953, a spraying campaign in Sri Lanka resulted in the almost complete eradication of malaria. I think there were about 18 cases reported that year. Dr. Mueller was so honored for discovering DDT that he actually won a Nobel Prize in 1948 for the chemical. And by 1953, the National Academy of Sciences credited DDT for the prevention of 500 million insect-borne deaths and another billion insect-borne illnesses. So it really, really revolutionized public health. Additionally, farmers, for the very first time in their careers, had a really powerful insecticide that you could treat locusts with. And if you think about locust outbreaks, and currently right now the desert locust is the most voracious predator of crops out there, and there is a big outbreak right now involving Kenya, Somalia, sweeping into the Middle East and getting into India and Pakistan. And a swarm of locusts can eat in one day, a small swarm can eat in one day will feed 500 people for a year. So these are really, really important crop pests that are known to cause famine. Fall armyworms, another significant crop pest. And so never before the 1950s, 40s and 50s did farmers have access to such a potent insecticide. So it really contributed to food security. So fast forward though a little bit, and this lady by the name of Rachel Carson became very concerned about the off-target effects that DDT was having. So DDT did not only just kill plant pests, it was also really responsible for mass die-offs of beneficial insects, ladybugs, butterflies, and things like that. And so Rachel Carson and a variety of people who were her colleagues became very concerned about the off-target effects of DDT and how DDT bioaccumulated up the food chain. And there was a thought that it interfered with the actual hardening of eggshells of large birds of prey. And so there were concerns about large birds of prey dying off and how this was going to impact the rest of the environment. So she wrote this book, this very influential book called Silent Spring. And because of this book, the environmental movement was born, and the Environmental Protection Agency in the United States was born. And so in 1970, the first order of business of the EPA was to ban DDT. Now, Rachel Carson knew that farmers actually really relied on this product, on DDT, and knew how important food security was. And so she actually wrote in this book about an alternative to replace DDT. And that was a totally natural chemical made by a bacterium called Bacillus thuringiensis, or BT, that organic farmers spray on their crops to this day. Where companies like Monsanto and Syngenta really got smart was they discovered the gene in that bacterium that made that chemical and put it in the plant. And so then you didn't need insecticide largely, or you needed much less insecticide to treat your crops. So that's kind of how GMOs were born, but that's a topic for a different day. So there is a dilemma that comes across when you think about sort of pesticides in general. And the dilemma is that with global warming, you're seeing a resurgence in infectious diseases that are vector-borne, that are moving further and further north. And this particular mosquito is called the Aedes mosquito. The mosquito is the biggest killer of man worldwide. There are about 750,000 deaths a year from mosquito bites. And this particular mosquito is the Aedes mosquito, which carries a variety of different viral infections. This mosquito is invasive and was discovered in Texas in the 1980s and since has migrated as far north as New York State. And incidentally, it was just picked up in either Belgium or the Netherlands just recently this year. So it's migrating into Belgium and the Netherlands. And it carries a lot of viral illnesses that have no treatment. So Zika, which causes devastating neurologic injury in babies. It carries dengue, which is a hemorrhagic fever, West Nile, chikungunya, and a whole variety of diseases that have no treatment. So it's really important to control these diseases. So the dilemma is that because pesticide development is so slow, and we're going to get into that a little bit, they take 8 to 10 years to test and develop and register, and it costs close to now actually 200 million, is actually shortening it a little bit, but getting closer to about $250 million to go through the battery of testing that you need to do. And that does not include the cost of building for production facilities. In the meantime, while this is all happening, there's been increasing public concern over the use of pesticides and genetic modification of mosquitoes or other organisms. It becomes very difficult for companies to balance the concerns over pesticides and insect-borne illnesses. There are questionable reports out there that allege associations between pesticide exposure and neurologic illness, ADHD, cancer, autism, and many other diseases. So you see these things coming out and getting a lot of traction in the press. Now, just to clarify, and you probably know this, but I was surprised at how few physicians know about this. So physicians are trained in medicine and physiology and a whole lot of things, but they don't pay a lot of attention to toxicology and chemistry. And so physicians, while they have a little bit of a background in this type of work, they spend most of their time in pharmaceuticals and things like that. So they don't necessarily have a great depth of understanding. Often they have a very lay understanding of pesticides. That said, they are a driving force in discussing some of the toxicities associated with it. And so I often have to clarify the different kinds of pesticides. So pesticide is an umbrella term that covers several different kinds of chemicals, classes of chemicals. So herbicides kill weeds and invasive plants like kudzu and honeysuckle. Insecticides kill bugs like ticks. Well, a tick is not quite by definition a bug, but we're going to throw it in that category. But ticks, mosquitoes, fleas, lice, and bed bugs. If you think about it, organisms have co-evolved to secrete chemicals that kill other organisms. So antibiotics kill bacteria. If you think about penicillin, penicillin is secreted by a mold, and it kills strep and staph and typhus and other bacteria. Lots of our antibiotics come from soil organisms, and so they are really produce these chemicals to defend themselves. Antivirals kill viruses, and fungicides kill fungi. And when we think of human infections with fungi, you think of things like athlete's foot, but plants can also be susceptible to fungal infections. In fact, insects often carry fungi on their exoskeletons, and when they prey on a plant, they deposit those fungi and result in a fungal infection, and those fungi can secrete carcinogenic mycotoxins, so they can make your product be contaminated with something like aflatoxin, which is highly regulated. So that's the way to kind of think about them in your mind. So what do we do to demonstrate that our products are okay to go to the market? So one of the big sort of discussions around the marketing of chemicals and the regulatory process that's required to put a chemical on the market is that companies pay for the studies, and people worry that because companies pay for the studies and they have a product to sell, that somehow the bias is going to get introduced to those studies, and those studies are going to not reveal, not be reliable. So the way this works is the OECD and other regulatory agencies have gotten together and have made have designed protocols under a term that's called Good Laboratory Practice, or GLP studies. And this is an order for the company to get a very good idea out of the lab and then onto the market so it can benefit the most amount of people. These studies, the protocols are designed by the regulatory agencies. They are auditable by the regulatory agencies, and they cost, once again, about $250 million and take about 10 years to produce. And so it's incumbent upon the company to pay for, rather than the taxpayer, to pay for the studies that demonstrate the product safety. And so this is a kind of a list of the kinds of studies that are involved in this. And so once again, these are under GLP protocols, so that they are validated, that they are reproducible, that independent organizations can come and under the same protocols be able to demonstrate that you can repeat these studies and get the same results. These studies are very intense. The EPA can audit your lab. They can look at your books at any time during this 10-year period and shut down your study. Adverse effects are reportable by law. So if an animal dies during your study, that's reported to the EPA. If an animal gets wobbly during your study, that gets reported to the EPA. If your product is on the market and somebody drinks it in a suicidal gesture, that is reportable to the EPA. And then once the product is registered in a country, it undergoes re-registration every certain set of times. It's generally every 15 years, and so in that time frame, the company reviews again all of the data that's accumulated since the previous registration. So these are very, very rigorous tests that look at environmental effects and also effects in humans and domestic animals. They are acute studies and subacute studies, chronic studies, looking at a whole variety of different issues. And once again, very, very rigorous, very, very expensive to conduct. So what does this battery of studies say about glyphosate? And we're going to talk about glyphosate in particular as a model for other chemistries. What this says about glyphosate is that glyphosate is not acutely toxic. It's by any route, oral, dermal, inhalational. In fact, it really doesn't get absorbed. Less than 1% of it gets absorbed through the skin. It's not irritating to the skin. It's not a sensitizer. Importantly, it is not genotoxic or carcinogenic. Now remember, cancer is a disease of DNA. And in order to be a carcinogen, you either have to directly interact with DNA and turn it on and make cells divide rapidly, or you have to be an indirect activator of DNA. And there's no, glyphosate doesn't do this in any capacity. It has no mechanism for getting into the cell through the membrane of the cell nucleus, interacting with DNA and turning it on or off. Likewise, it doesn't trigger anything else to do that. And this has been looked at by not just our company, but multiple agencies. So we'll get back into that in just a moment. It's not a reproductive toxicant. It's not an endocrine disruptor. It's not a teratogen. It's not neurotoxic or immunotoxic. Now, glyphosate came off patent in 2000. So Monsanto was the original patent holder. And so Monsanto did the original dossier full of those studies that we just discussed a little bit. And since it went off patent, 6 other registrants picked it up and did their own individual studies looking at the same battery, looking at these properties. And all of them have come to the same conclusion that everything on this slide is accurate, that these studies have all been reproduced. So there are literally thousands of studies, safety studies out there on this product by multiple different companies and multiple independent organizations that all agree that glyphosate is not a carcinogen. So how do we know what happens with chronic low-level exposures? Well, one of the ways you can look at chronic low-level exposures is by looking at epidemiology. And with epidemiology, you take a cohort of people and you follow them over time. You record what their exposures are, and then over time you find out what kind of outcomes they've had in terms of disease states. And then you can sort of see if there's any association between an exposure and a disease. And so I'm going to introduce you to this particular study. We're going to focus on cancers because that's the kind of hot topic of the day. And we're going to get a little bit into what's happened with pesticides and glyphosate. So this particular study is conducted by the National Cancer Institute of the United States and the International Agency for Research on Cancer, or IARC, which are independent agencies that are, IARC is part of the World Health Organization, and the National Cancer Institute is part of the US government. And what they've done is they have taken this study in France, where they've been following about 180,000 people who are involved in farming in some capacity or another. So you might have an insurance person selling, insurance to farmers, and then you also have bankers who give loans to farmers. Then you have the farmers themselves, and then people who apply pesticides. And so what they are looking at in this particular cancer sector is about 100,000 people. And they are examining pesticide exposure in general to cancer outcomes in general. Now, like I said, most physicians don't really have a lot of background in pesticide toxicology and carcinogenesis and things like that. So when patients come and ask them questions about studies, they will really quick go look up something on the internet, maybe pull this study because it seems like a well-conducted study, and they will read the abstract really quick. And most people will just jump to the conclusion of the abstract because it gets very wordy, as you can see from here. And we're going to jump to the conclusion. We're going to read the last sentence. And the last sentence says, specific subgroups had a higher cancer incidence related to occupational status and pesticide use. So according to this 2017 paper, it sounds like there's an association between pesticide use and cancer incidence. Well, let's dive into that in a little bit. So, and just as a preface to this, a lot of epidemiology can be like chloroform in print. I promise I will only briefly touch on this because I don't want to put anybody to sleep. But for the time being, we are going to pay attention to the last 3 rows under the heading of pesticide use. So as you can see, there were about, in all, let's go all the way back to the left, there were about 100,000 people participating in this study. And if you go back to the pesticide use columns, you can see over half of them were putting pesticides on crops. About 4,500, 4,600 people were putting pesticides probably on at home. So, you know, if they had fleas or termites or things like that, they were using pesticides at home. And another 3,000 were not using pesticides at all. So the way to interpret the numbers under these columns is that if you have a number that's bolded, the numbers that are bolded, if that number, the first number is less than 1, so in pesticide use on crops, if you scroll down, you'll see that here there's a number that says 0.94. And that's the standardized incidence ratio. If this number is less than 1, it means that you have a decreased risk of cancer. If this number is 1, it means that there is no difference between the 2 groups, people who are exposed and people who weren't exposed. If it is greater than 1, that means that there's an increased risk of cancer. And then how do you know that that's not due to chance? Well, you look at the confidence interval, which are the bolded numbers in brackets here. If I can get this cursor to get there. So you can maybe see, where's my cursor? You can maybe see, so here we go. So here you can see that this goes from 0.91 to 0.97. If this confidence interval includes the number 1, it means that it is not statistically significant. So what we can gauge from this graph, from this table, is that men, when they were looking at cancers, okay, out of the 100,000 people, there were 7,304 men who developed cancer, all right? When they looked at the people who developed cancer in the pesticide group, 3,600 of them had put pesticides on crops. 400 of them had used other pesticides, and 362 had used no pesticides. And you can see that there was a decreased incidence of cancer at all sites in men that was statistically significant, a decreased incidence of cancer in people who are putting pesticides on crops. And what about women? So women, all sites. Back to our columns here, there were 474 women who put pesticides on crops. You can see that the confidence interval here includes 1, it crosses 1, so this is not statistically significant. However, people who were using women who were using pesticides at home had a statistically significant decreased risk of cancer. So let's look at a little bit more common cancers. So what's the most common cause of cancer death worldwide? It turns out to be lung cancer. And so we're going to look at trachea, bronchus, and lung in men at all sites. If you scroll back all the way over to your column where it says pesticide use, you can see there is a statistically significant, markedly statistically significant drop in the incidences of lung cancer. And in fact, it goes like that all the way across the board. So laryngeal cancers down, oral cavity cancers down, mesotheliomas down. Very, very marked decrease in cancer in people who are exposed to pesticides. Now, I'm not going to make the claim that pesticides cure cancer. I'm not going to even make the claim that pesticides prevent cancer. But out of this data, I'm certainly not going to make the claim that pesticides cause cancer either. So let's go and look at what we've seen in terms of glyphosate. So this is the agricultural health study. The agricultural health study has been following about 57,000 farmers who are pesticide applicators in Iowa and North Carolina since 1993. And they did their first iteration where they looked at 1993 to 2003 and then collected all the data and published this study, Cancer Incidence Among Glyphosate-Exposed Pesticide Applicators in the Ag Health Study. And Aaron Blair, who ran the National Cancer Institute, also ran this study. And what they found in this study was out of those 50 some odd thousand folks, 2,000 developed cancer. All right. Out of those 57,000 people, also, the vast majority had been exposed to glyphosate. So about 75% of the people who developed cancers had been exposed to or had ever used glyphosate. And what you can see in the third column over is that there is not any association between glyphosate and any kind of cancer, including non-Hodgkin's lymphoma, when they're adjusted for age or adjusted for any other things. So it looks like there might be a slight bump in melanoma, but as you can see, the confidence interval includes 1. So that's not statistically significant. And if you control for other things, there's no significance at all. So what they concluded was that there was no relationship between glyphosate and any kind of cancer. So imagine our surprise in 2015 when the International Agency for Research on Cancer came out with its monograph that got summarized in the Lancet, which is a top-tier medical journal. I'll tell you, the Lancet has an impact factor of about 60. The top ag journals have impact factors of about 4 to 6. So the Lancet is a hugely influential journal. And they published the IARC monograph, so the summaries of the IARC monograph. So imagine our surprise when the Lancet published this monograph saying that glyphosate was a carcinogen. Now, one of the very, very key things to note was that in March of 2015, 17 experts from 11 countries met at the International Agency for Research on Cancer to assess the carcinogenicity of the organophosphate pesticides, tetrachlorvinphos, parathion, malathion, diazinon, and glyphosate. They, right at the get-go, misclassified glyphosate into a category of chemical that has a much different toxicity profile. In fact, these are all insecticides. Glyphosate is a herbicide. Glyphosate is not an organophosphate. It does not cause a cholinergic toxidrome, but the only sort of class of pesticides that doctors have much experience with is the organophosphate class of pesticides. And so automatically, when this was published in the Lancet, it actually made doctors think that it was an organophosphate and had a much different toxicity profile. So this was the first big piece of misinformation that was brought about. Now, going back slightly, I remember I said that in each country that a pesticide is registered in, it will undergo re-registration every 10-15 years. And glyphosate has been registered in over 160 countries. And because it's registered there, it actually undergoes re-reviews almost every 3 to 5 years. And so prior to the IARC monograph, you can see here from 1987 all the way to 2013, it got re-reviewed by a variety of different agencies, including the World Health Organization, Canada, US, Japan, Australia, a whole variety of different places. When the IARC monograph came out, that prompted a re-review of all of the data that was out there by multiple regulatory agencies around the world, because they were thinking, oh my gosh, did we miss something? And so they went and looked at all of the data that IARC reviewed, plus all of the industry data that was out there that was used for registration. Now, how did IARC come up with a completely different outcome than the Canada, PMRA, the EU, EFSA, Japan, New Zealand, US EPA. The US EPA even convened its own cancer committee to look specifically at this question. All of this at taxpayer expense, great taxpayer expense. Well, IARC only reviews published literature. And you'll remember that industry data isn't really meant for publication. It's actually meant because it's meant to actually sort of supply safety data to regulatory agencies to demonstrate the safety of the product before it goes on the market. So Monsanto, actually knowing that IARC was going to review this stuff, actually published our data to give to IARC so they could review it. I have a more complete data set. The committee of 17 people did not review it. So what you have is you have a committee of 17 people with a monograph reviewing incomplete data versus literally thousands of scientists over 45 years reviewing thousands of different documents relating to data. And they all have repeatedly concluded that glyphosate is not genotoxic and is not a carcinogenic hazard to humans. So what other kind of independent data can we use to confirm this? Well, if you look at what's happened with glyphosate use in the United States, Roundup Ready crops were introduced to the United States in 1996. And if you look at the graph on the upper left here, you can see glyphosate use has increased really, really dramatically with the introduction of Roundup Ready crops. And what has happened with non-Hodgkin's lymphoma, which is the cancer that people are saying is glyphosate's associated with? Well, since 1996, there has been no, between 1996 and 2016, there's been no increase in new cases of non-Hodgkin's lymphoma. And in fact, there's been an actual decrease in deaths, mortality associated with non-Hodgkin's lymphoma. So there's not a corresponding increase in non-Hodgkin's lymphoma and glyphosate exposure. Now, the other thing about non-Hodgkin's lymphoma in general is that if you have a toxin that is a carcinogen, you should see the same kind of cancer happening with that exposure over and over and over again. So we know that asbestos is associated with mesothelioma, an extraordinarily rare cancer of the lining of the lung. And so we see that association over and over and over again. Well, it turns out that non-Hodgkin's lymphoma is actually not one cancer, but it is a multitude of cancers. In fact, it's about 60 different extraordinarily rare cancers of the cells of the lymphatic system. And glyphosate is not associated with any single one of those, nor is it associated with the overall category of cancers by study after study after study. So, so there's not a mechanism, there's not epidemiologic data that suggests it, and there's not alternative data that suggests that this exists. Now, back to the Ag Health Study again. So between 2003 and 2013, Aaron Blair, who also ran the IARC committee, and everybody on this study gathered another 10 years worth of data. And they had the data to publish the next iteration of the Ag Health Study in glyphosate use in cancer incidents. Unfortunately, in 2015, when IARC was reviewing all of this data was not published, and this was not available until 2018. And in this updated evaluation of glyphosate use and cancer risk, we observed no associations between glyphosate use and overall cancer risk, or with total lymphohematopoietic cancers, including non-Hodgkin's lymphoma and multiple myeloma. So once again, they demonstrated there was no association between glyphosate and any kind of cancer. Here are their numbers for non-Hodgkin's lymphoma. Now, the problem is that when an agency like IARC makes the claim that a product is a probable carcinogen, let's be clear, so IARC has 4 categories: probable carcinogen, definite carcinogen, probable carcinogen, possible carcinogen, and not a carcinogen. So now IARC has evaluated over 1,000 substances in its career and has only come up with one chemical that they say is definitively not a carcinogen, and that is caprolactam, the stretchy stuff in yoga pants. Everything else has fallen into the possible, probable, or definite category. So when IARC says that something is a probable carcinogen, that triggers a regulatory item in California called Prop 65. And if your chemical is listed on Prop 65, your label is required to say on it something along the lines of, this is known to the state of California to cause cancer. And so the issue is that for glyphosate, it is not a carcinogen. And so labeling it as such is actually not allowed by the EPA. So the EPA, once again, established its own cancer committee to review all this data, and once again, reaffirmed that there was no risk for public health. When people were clamoring to have the glyphosate products labeled under Prop 65 in California, the EPA actually said, no, you can't. It is irresponsible to require labels on products that are inaccurate when EPA knows that the product does not pose a cancer risk. We will not allow California's flawed program to dictate federal policy. And it turns out that Prop 65 is actually a driving force for a lot of litigation. A lot of tort lawyers will take companies to court over Prop 65. And so because of that, we have been sued and lost in California courts 3 times. So we've had 3 cases in California taken in front of juries, and they are now all under appeal. And so this first case is the Johnson case, which was a case where a school groundskeeper spilled a glyphosate-based herbicide on himself and made the claim that it actually caused his lymphoma. That case is under appeal right now. And we have actually had on appeal amicus briefs filed by the California Medical Association, California Dental Association, and California Hospital Association on our behalf. And what that amicus brief talks about is how important it is to use a scientific background and have real science in court before you make decisions. Juries are not the ideal forum to be making legislation or to be driving decisions about whether or not a chemical has carcinogenic properties, because you have a regulatory apparatus that's already built to do that. So what's happening a lot is with things like this, you're getting populations very concerned that there's some problem with the product. And when you wind up having regulatory bodies which are designed to protect the public health and safety of people, looking at thousands and thousands of studies versus a jury that is looking at sort of cherry-picked studies, or a legislator, for example, who asks one expert to pick 1 or 2 studies, you can have regulation by legislation or regulation by litigation, and that is actually really undermines the regulatory process, and that's a huge problem, because when you have a group of 17 people, or one expert here or one expert there making claims without all of the benefit of these dedicated scientists that work in these organizations like the EPA, you really can get a very skewed view of a chemical. And so a lot of people say, so well, why does a jury find in favor of the plaintiff if there's no scientific basis for it? Well, if you think about it, most juries tend to be lay people, don't have a lot of experience with epidemiology, don't have a lot of experience with toxicology, and so they'll have experts from both sides making claims from both sides. And remember, epidemiology tends to be chloroform in print. So you have a very snoozy bunch of people trying to make very difficult decisions, hearing 2 experts weigh in. And in the meantime, they're looking at an individual who's very sick. And empathizing with him. He's young, he's got kids, hospital bills in the United States are extraordinary. And so when they see that setting, they empathize with him. And they see a big company and they think that big company's got deep pockets, and because that big company's got deep pockets, they can afford to pay the man's hospital bills. They can afford to, offset some of his costs. Layer into that inflammatory statements, and the jury gets very upset. And this topic was addressed in this amicus brief. And so the California Medical Association has filed on our side. So I hope that gives you some perspective on how juries work in the United States. Now let's get into the safety of glyphosate. I'm going to speed up just a little bit, but once again, glyphosate is not an insecticide. It's not an organophosphate. The way it works is it prevents plants from making aromatic and needed amino acids that it needs for growth. It blocks the shikimate pathway. Animals and humans are really not effective because they don't have this enzyme in their cells. Now, there's some microorganisms that do have the enzyme, and we can address that later, but we really don't have that pathway. Glyphosate does not evaporate into the air. It's got a very high water solubility and low fat solubility, which makes it not bioaccumulate. So it has very low absorption through the skin, less than 1% absorbed through the skin. And if you do get any trace residues in you, it is not metabolized. It is eliminated as parent compound from the body. So it doesn't interact with cells or P450 system or things like that. The formulations are simple. You've got glyphosate as the active ingredient. You have surfactants in there, like a detergent. It's like laundry detergent kind of, or shampoos. And then you also have an anti-foaming agent. Simethicone is a pharmaceutical that people take for intestinal gas. They have something along those lines in there to make sure it doesn't get too foamy. You also sometimes have some food coloring as a colorant, and then water. Most surfactant exposure comes from shampoos, soaps, and detergent at home. You have more surfactant residues on your plates and forks and knives from washing them in the dishwasher than any kind of crop will have on it at any time. And once again, this is a fairly standard formulation. Glyphosate from major producers all meet the FAO standard for purity. Now, lots of people are worried about residues. We just touched on residues, and this is kind of an interesting topic. This is a 1990 study. It's an old study, but it's a great study produced by, published by Bruce Ames in the Proceedings Academy of National Academy of Sciences. And it turns out that most pesticides are natural chemicals that plants make to defend themselves, 99% of them that you consume. And that makes sense. Why? Because plants have had to co-evolve with creatures that eat them, and plants can't run away from you. So they make chemicals like lectins, tannins, even cyanogens. If you think about it, peach pits have cyanogenic compounds in them because they're protecting the seed, right? And so they want to protect those seeds, right? So when plants are stressed or damaged, they greatly increase their natural pesticide levels. In this old study, to date, at 1990, there had only been 52 of those natural pesticides that had been studied. 27 of them were rodent carcinogens. Now, we would never tell people not to eat fruits and vegetables on the basis of this study, because we know that fruits and vegetables are good for you, have vitamins, and it can actually contribute to have a beneficial effect on your health. These rodent carcinogens, 27 of them, were commonly found thousands of times higher than any synthetic pesticide residue that you'll find on a plant. Americans eat about 1.5 grams of these natural pesticides a day, and that's 10,000 times higher than any synthetic residue consumed, and vegans likely eat more. Now, there's much consternation about pesticide residues on food. These are monitored by the USDA, the U.S. Department of Agriculture, and regulated by the EPA. The EPA sets strict limits on pesticides left on foods, and these are called tolerances. 99% of sampled products have residues below the EPA tolerance. Residues at or slightly above tolerances do not approach the allowable daily intake. And the ADI is set by a battery of tox studies in animals. Remember that huge battery of tests that cost $200 million in 10 years to do? That's part of the way you set up the ADI. And what it is the no observed adverse effect level with a safety factor built in of 100 or 1,000. So the non-toxic dose in animals with a safety factor built in. And here's a sort of graphic that demonstrates what I'm talking about. So let's just take soybeans, looking at the top of the graphic. What they will do is they will make the tolerance the actual maximum rate application to provide that you can put on your crop. Each crop has its own tolerance, all right? And then the EPA will take an overall exposure assessment where they will look at all treated food, they'll look at air and water, and they will make sure that there is nothing that goes over the maximum exposure, taking sensitive populations into account, including children. And that maximum exposure is orders of magnitude below the allowable daily intake, which is the non-toxic dose in animals with 100 to 1,000-fold safety factor built in. So a non-toxic dose means that residues, the residues that you are exposed to don't have toxicity. So what does that mean for glyphosate? So how much would a 55-kilogram adult have to eat to reach the ADI? Well, you would have to eat 11 pounds of soybeans every day for 70 years to reach the ADI even once. You would die of soybean poisoning before that ever happened. How about residues in cereals that we hear about? Well, you would have to eat a Fruit Loop this big every day for 70 years to reach the ADI once. You would die of Fruit Loop poisoning before you ever got to the ADI, which, remember, is the non-toxic dose in animals. Well, what about bans? So why are bans important? Well, because bans have really important consequences. Now, I'm going to backtrack just a little bit. If you remember that agriculture is the foundation of civilization. When some guy or gal planted a thatch of wheat in the Mesopotamian River Valley 10,000 years ago, he or she freed up the rest of society to be able to build schools and bridges and buildings and do great feats of engineering and things like that because they had a stable food supply. Now, we have had 10,000 years of organic farming under our belts and only 50 years of food security in the West. And that's because of modern advances in modern ag. And that 50 years includes the use of pesticides. And so we really need to think about it that way. Now, on top of that, if you think about Roundup Ready crops, glyphosate actually becomes the foundation for both North and South American agriculture across the board. So if you ban it, you're talking about having a huge impact on the productivity of agriculture, not only around the world, but in the West as well. And so I'm just going to show you a little example of a little country that has banned it and had banned it and what the outcome was. So in Sri Lanka, there were claims in 2015 that glyphosate was associated with some kidney disease. And if you think about Sri Lanka, it's a tropical island in the Indian Ocean. It just is recovering from a 27-year civil war that still flares up every once in a while. If you think about it, it also had a big tsunami in the mid-2000s that killed lots and lots of people. And it has very fragile food security. It turns out that tea is its major export. Ceylon tea is a very high-end tea that actually pays for a huge proportion of its food imports. It pays for over 71% of Sri Lanka's food import bills. With the ban on glyphosate, the jungle started growing into the tea plantations, and the jungle grows very quickly. So you had an expansion of weeding costs of 1,500%, huge crop losses in terms of rupees, which is their currency. And when the jungle comes into your crop, a lot of things come with it. You now have young Tamil women hand weeding the jungle. And what happens when you start hand weeding the jungle? You wind up with an increased incidence of snake bite, which gets very concerning. And there are reports in the newspapers of farm workers who are refusing to go to work because of the risk of snake bite. And incidentally, they don't have wussy snakes like we have in the West or in the United States. In the United States, we have rattlesnakes and water moccasins, copperheads. These snakes that they have in Sri Lanka are cobras and kraits, really associated with bad morbidity, significant mortality. Snake bite has recently been recognized in 2017 by the World Health Organization as one of the leading neglected causes of morbidity and mortality worldwide. And they have really started funding research in that, and it largely affects rural agricultural communities who are working with their bare hands. So there's a big mortality associated with this, and that needs to be taken into consideration. I'm going to close by saying pesticides are critical for human health. If you look at the upper left-hand corner there, that is a flea. The flea is responsible for wiping out about a third of the European population in the 1300s during the plague, the bubonic plague. How that got started was when sort of one of the first recorded cases of biologic warfare. In the early 1300s, the Tartars were laying siege to Kaffa, which is a walled city near Sevastopol, in what's now Sevastopol. And there was an outbreak of plague in their ranks. Remember, plague is a bacteria that's carried by rats, and it's transmitted by fleas from the rats to people. When fleas feed on a rat, they get an inoculum of bacteria in their throats. Those bacteria rapidly multiply and clog up the flea's throat. The flea bites a person and has a feeding frenzy where it repeatedly regurgitates Yersinia pestis, which is the name of the bacterium, into the person who becomes sick. Well, the Tartars wound up launching bodies into Kaffa, and that caused mass panic with people fleeing the city and spreading the plague across Europe. The flea is also an important carrier of pathogens in Los Angeles today. Right now, there's an outbreak of typhus, which is once again carried by rats and transmitted by fleas to people. In Los Angeles, City Hall wound up having a big outbreak, and lots of people are getting sick from this medieval problem. Now, how can you control this? Well, you can control the rat population with vitamin D. Vitamin D is a pesticide, the very same vitamin D that you make in your skin when the sunlight hits your skin. It makes vitamin D. So you could control the rat population with vitamin D, and you can control the flea population with pyrethroids, so synthetic chrysanthemum dust. Very, very low toxicity chemicals that actually prevent the spread of diseases, medieval diseases. Incidentally, the rat population in Los Angeles also carries the plague. About 1.5% of rats are found to have the plague. The Department of Health watches that very closely and are concerned that if that level gets up to 2%, that you could see a jump to the human population. Pneumonic plague, which is a lung form of plague, has 100% mortality if not treated within 24 hours. So if you had a homeless person as your index case who dies and is not discovered for a while, and then is taken to the morgue and once again not discovered that he's got the plague until for a while, you could have the potential for a very big medical problem. Ticks carry Lyme disease and Rocky Mountain spotted fever. Once again, the mosquito is the leading killer of man worldwide. Lice are a huge problem. Body lice actually carry epidemic typhus, which has a much higher mortality rate than the louse-borne or the flea-borne typhus. Well, so that's insects. But what about weeds? You know, weeds, you think about, well, outside of labor costs, how do weeds actually impact public health? Well, last year, France had to recall a huge shipment of its green beans because they were contaminated with this. This is datura, which is a very beautiful flower, which is a weed that's found everywhere. The seed pods carry seeds in them that contain scopolamine, hyoscyamine, and atropine. And food that's contaminated with this plant can make people have a very florid toxidrome. So what it does is it makes people have become wildly delirious, hallucinating madly, rip off all of their clothes, go streaking naked, all over the place, and they wind up having seizures, heat stroke, a really florid bad outcome. You don't want toxic weeds in your food supply. Another case that you can think of is that Abraham Lincoln's mother actually died of milk poisoning. And what happens there is cattle that get into a white snake root, which is a weed, concentrate a toxin called trematol in their milk. And if the people drink that milk, they wind up having a toxidrome where they have muscle spasms, seizures, coma, violent GI distress, nausea, vomiting, diarrhea, and ultimately die. And that's how Abraham Lincoln's mother died. So weed control is actually very important from a toxicology standpoint. What about fungicides? Well, fungicides are very important. Insects carry fungi on their exoskeletons, and when they prey on plants, can introduce those fungi to that crop. And once again, fungal infections tend to secrete carcinogenic mycotoxins. And so fungicides are really important and insecticides are really important for this food supply. So the takeaway message is that pesticides are some of the most important advances in control of infectious diseases of not just people, but plants as well. There are over 1 million insect-borne deaths per year. Half the world's population is at risk of insect-borne diseases like dengue, which once again is a hemorrhagic fever, yellow fever, filariasis, onchocerciasis, and Zika. Malaria and other infectious diseases were wiped out in the USA and Europe by draining swamps and using pesticides. Pesticides are more regulated than antibiotics, and it's really important to understand that the integrity of the regulatory process is intact. They make a major contribution to public health, and bans put the food supply and children's health at risk. So you can follow me at Twitter. If you have questions, I'm happy to answer them. I am perfectly happy to talk about any topic, including questions about Monsanto. If you would like some resources about where to find out about glyphosate litigation, you can go to the Bayer website. And as part of our transparency initiative, we have put all of our industry studies online so people can evaluate them for themselves under our glyphosate section. And at this point, I'm happy to take any questions.